You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Aultman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Renee Meyer and Frantz with Mental Health Intensive Outpatient Program of Aultman Hospital. Good morning, ladies, and welcome to the show.
Good morning. Thank you.
Good morning. Thanks for having us.
Well, good morning. We'd like to remind our listeners that our Health Matters programs are all available on our podcast. You can look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app. Please subscribe to our program, and thank you very much for joining us this morning.
So, Renee Meyer is a licensed professional clinical counselor. Tell us about yourself and your position, Renee.
Okay. I am part of the team that runs the intensive outpatient mental health program at Aultman Hospital. And I've been at Aultman for about 10 years. I've had, my background includes severe mental health and substance use disorders. And I've been a case manager, supervisor for case managers, and yeah, I've got a varied background of experiences. So I've been at this for a long time, and I enjoy it.
Okay. And Molly Frantz is a licensed professional counselor. Tell us about yourself and your position with the outpatient program.
Yes, so my name is Molly, and I am a counselor here in the IOP program, as well as the registered art therapist in the program. And I have a background in both counseling and art therapy, and I've been in this program at Aultman Hospital for about 5 years or so now, in the field for probably about 8 to 9 total. And I have a varied background in working with families, young children, adolescents, as well as severe mental health, some substance abuse, and just really enjoy this atmosphere, the working environment, and the team that we've developed here for our program. It's been working really well.
Okay.
Okay, Molly, what is IOP, or Intensive Outpatient Program?
Yes, so IOP, or Intensive Outpatient Program, is considered a higher level of care in the mental health field. So there are various levels that you can receive mental health treatment, and IOP is considered one of the higher ones. And typically in an IOP, you are attending a program, or you're attending typically groups for about 3 to 4 hours a day, typically. And it varies throughout the week how many days you attend. And typically one of the big differences for an IOP versus perhaps, an inpatient stay when somebody is admitted to the hospital would be, once you attend IOP groups, you then go home after you complete your day in the program. You don't stay here overnight, and you are, you go back to life after you attend the groups in the mornings typically. Mm-hmm.
So how does a person know if they need more than a counselor?
Yeah, I'll take this one. So the patients that come into an IOP have usually been seeing a counselor, not always, but usually been seeing a counselor, and a person doesn't see a counselor but maybe once a week, once every couple of weeks, and so it's just not enough for their symptoms. A lot of times a person needs IOP when they're coming from an inpatient unit and need a little bit more support. An inpatient unit for mental health basically stabilizes people, and we continue on with that, but then they move forward and they start thriving a little bit more than just surviving. But an IOP program is also good for a person whose symptoms are just not getting better, and maybe they haven't been seeing a counselor, and and their symptoms have gotten to the severity level it's really just not enough right now. So that's when we bring them in. And so, yeah, it's for people coming from an inpatient unit and then keeping symptoms from getting worse. And sometimes we'll get phone calls and somebody will ask about, they'll think they need an inpatient unit. And it's really not the case. So we can be considered that stopgap. So somebody's symptoms are pretty severe, but if they come in the program, we can help them avoid going inpatient. So.
Okay, so tell us about your intensive outpatient program at Aultman.
So our IOP here at Aultman Hospital, we are here every day, Monday through Friday, and our groups run from 8:30 in the morning until 12 in the afternoon. And on average, I mean, even though we are every day, which some other IOPs in the area, their schedule varies, but because ours runs Monday through Friday, we've noticed the average length of time that somebody's in our program is on average about 12 days only. And so that's one of the big differences in our IOP here at Aultman Hospital than some of the surrounding area IOPs that we are familiar with. Mm-hmm. And what we've noticed in that change from other IOPs is that some individuals, if not most, are coming in with numerous stressors, whether it's work, family responsibilities, just the busyness of life. And there is a deep desire to get back to it sometimes as quickly as they can. And so the commitment to perhaps a longer program can sometimes deter people from participating in an IOP. Mm-hmm. So
most people are working before they come in here, and they want to get back to that working and family.
Mm-hmm. So our IOP offers the quickest way typically to get through an intensive program and receive the higher level of care help that could benefit them, but also with a timing that is more suitable to meet their needs, mm-hmm. which is helpful.
Yeah, and like Molly said, because they come in every day, there's that consistency in building on things pretty quickly, and so they don't have to stay as long. We also have a follow-up group called Pathways, so that when somebody does graduate from the program, it's additional support. They're not just coming 5 days a week and then boom, there's nothing. So then they'll come to Pathways, which is then once a week. It's about 90 minutes, and it's there for them if they need it, if they need that follow-up support. And we do get some people that come, but some people have to get right back to work. And the people that come to our program are very high functioning when they're feeling good. We've had attorneys, we've had nurses and business owners and business managers, teachers, engineers, and but the big, I mean, very intelligent, high functioning people when they're feeling good, but they're just not feeling good. Like Molly said, because of a lot of stressors, and sometimes just their symptoms are the stressors. So we get them feeling better and get back to their lives. Want to tell them about the Dr. Snavely?
Yes, so while they're in the program here at Aultman Hospital, not only do they receive group counseling, predominantly from that 8:30 to 12 time frame, they also receive medication management services through Dr. Snavely here. And he is the psychiatrist that oversees our IOP patients in the program. And Dr. Snavely is here offering support and guidance. Does a very nice job, very patient-directed in helping anybody who has questions, concerns. It helps to have another set of eyes and ears on a patient's symptom while they're in the program. And that kind of helps also with that balance and benefit if anybody is coming in either already on medications, psychiatric medications for mental health, or if they're interested in them. But it also gives them a safe space to ask questions about them. and also a safe space to make that choice for themselves. If that's something they feel they want to explore, they have somebody in the field who's a professional and very experienced to help provide those answers. And so that's one of the better benefits too of our IOP here, is you get kind of the all-around treatment team approach between medication management, group counseling, as well as individual counseling while they're here in our program. We meet with them, any patient coming through our program, a couple different times for one-on-one counseling after they complete the groups throughout the day.
Mm-hmm. Yeah, because not everybody is comfortable talking about really intimate things in front of other people, and it's not necessary. And again, like Molly said, that's why we have individual counseling. But while they're in group, we're a very skills-based program, and the skills don't keep life from happening, but they help a person maneuver through life better than before. And so the concepts and the education that we provide, even though they're not talking about those things, those stressors in the most intimate details, they're still able to apply those concepts and apply those skills to the problems and the stressors that they're struggling with. So, yeah.
Okay, ladies, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
Okay.
Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to one of our pharmacists about our Health Matters membership savings program. We want to help you stay well and save money. So, what modalities or therapies is your program based on?
I think you guys are still muted. I'm sorry. There you go.
Okay, so the modalities or therapies that we cover in the program, CBT, cognitive behavioral therapy, which is one of the most empirically based, proven with outcomes basically for patients. So it's really impactful. We also have something called DBT, dialectical behavior therapy, and Aultman Outpatient Services actually has a whole group based on DBT. But all of these therapies are emotion regulation therapies. Again, Molly is our art therapist, and art therapy is an important piece of our program, we feel. And it's not just arts and crafts, that's not really what it is. It's using a different part of our brain to process our thoughts and emotions, and so it's a daily important piece that we have. It's a whole group, and I think that's CBT, DBT, art therapy. So one of the other ones that we cover a little bit is commitment and acceptance theory. And when someone comes in, one of the things that they're really struggling with is knowing how to accept what's happening right now and what their part is in moving forward. And so we help guide them through that.
How would a person benefit from participating in an intensive outpatient program with you?
So there are many benefits to participating in an IOP, and typically the feedback we've heard from many patients who have previously participated is the benefit of the consistency. That's one of the big benefits when anybody's coming into the program every day. I think Renee mentioned this earlier. There is something very powerful about going over things on a consistent basis and going over whether it's the skills, which is the focus of our program, skills and education, learning how to get back to living life and managing life a little bit easier. And that consistency plays a huge role in that, as well as being in a group setting. A lot of individuals who are coming to IOP haven't really had a lot of group therapy experience. And so just the unknown, the uncertainty of coming into something new that they've never done but then also being around other people can be a little bit nerve-wracking, a little overwhelming. And so it's also something that is very supportive. And what a lot of people have shared with us is the supportive environment, the welcoming feeling in the group.
The group dynamics.
The group dynamics make up a huge component to the success and benefits of the IOP program, at least for ours here at Aultman Hospital. And so a lot of times when our patients are feeling at their worst, they feel very alone. And they feel like nobody can understand what I'm going through. And I'm sure other people out there feel the same way, but when they come to IOP, they may not know exactly what the person next to them is struggling with, but the fact that we're all in the same room talking about the fact that we're all struggling and being able to use the skills to better their lives, there's camaraderie there. There's a wonderful dynamic of support and kindness that is felt in the program. So that's a huge benefit when trying to improve your life.
Mm-hmm. Well, while working on that solution-focused perspective, because typically people are isolating before they come in, and the first thing that they're nervous about is they say, I'm not good in groups, and I don't want to have to talk about things in front of people, and that's just not the way it is. We gently guide people through this, and when they hear, because we're an open group, meaning when somebody new comes in, we've got sort of vets in the program, as we call them, who are getting ready to graduate. And so the new people coming in get to watch the people that are just getting ready to complete the program. And it's very helpful. It gives an example. And first day, we always tell somebody, just chill, don't worry about, writing any notes down or speaking or anything like that. It's just a tertiary benefit is to get them out of the house and get structure back and get them back to living life.
So it's all group therapy, or is there individual therapy?
It's all group therapy, but we also meet with them individually for therapy also throughout their time in the program.
Okay.
We have what's called an intake where we meet with them one-on-one initially, and that's to talk to them about their symptoms and their stressors and just build rapport and allow their emotions to come down. And it's really fun to see somebody after that first initial intake, because stress and anxiety is up to here, and by the time they're done, it's already come down. And so it's really cool to see that. And then, like Molly mentioned earlier, they see the doctor, medication providers, and not everybody's on meds when they come into the program or when they leave, but there's somebody there to talk to about that and answer questions, and it's part of the program.
Interesting.
Kind of thinking too in your group setting too, everybody, well, I'm going to assume there are people that think that no one else has the same challenge they might. And then you find out real quick that other people have been through similar things, or at least you can identify with their journey too. So it's probably very reassuring, if you will.
Yes. Yeah.
Yeah.
So if a person's already gone through a group therapy setting or an IOP before, would they benefit from being part of the program again?
Yeah, we've had that. We don't get it a lot. People are doing pretty good usually when they leave us, but it does happen, because sometimes people go through human beings go through some very difficult things in their lives, and they're situational. Not everybody has ongoing chronic mental health symptoms, but they go through some pretty powerful and traumatic things. And so they might have gone to an IOP before, but could they benefit again? Absolutely. Absolutely. So, and like Molly mentioned earlier, not all IOPs are the same. And when we talk about stages of change that people are in, sometimes when somebody comes in a first time, they're just starting to become aware of and acknowledge what some of the things that are going on really are. And it takes a while for them to accept that and then understand how they apply that in their lives. And so people are different stages and different parts of their lives.
And sometimes, in addition to that, when somebody comes in and perhaps re-engages in the program, for the second time, it doesn't usually last as long. We like to call it a tune-up of the sort, because most of the time they might just need a little reminder of the skills, kind of that re-inoculation, if you will, of, hey, I know this stuff. It's a nice confidence boost to remind you, hey, it's coming back to me, and it starts to get easier, and they're able to move through the program typically a lot faster than the first time too. So that's why we like to call it a little bit of a tune-up, so to say, if we do find that somebody wants to come back to the program.
Are there any services in the program you'd like to highlight that we haven't talked about already?
I think we covered them nicely. And there's the individual counseling, there's the group counseling, there's the medication management, there's the art therapy. In the first group, we call that our goal setting group. It provides an opportunity to determine how you would like to feel today, what you would like to see happen today. Because as adults, we don't really go to bed at night or get up in the morning and say, how do I want to feel today? And how would I like, if I laid my head down on my pillow at the end of the day today, how would I like to reflect back on the day and feel about what I did? Do I want to feel a sense of accomplishment? Do I want to feel proud? Do I want to, because I've stepped outside of my comfort zone? We also very, very much help someone build that relationship with themselves. They might not have ever had one before. And typically somebody coming in the program feel very low about themselves. And so we talk to people about their strengths and how they'd like to describe themselves. And then we help them take that to the next step. How do I make that happen? It's a big piece is empowerment when somebody comes into the group setting. And it's really neat to see somebody's shift and somebody's change just within the first couple days, and then let alone by the time they leave the program. And it is really cool too, like I had said before, when you've got a vet in the program who's graduating and they see a new person coming in, we often will hear them say, oh my gosh, I remember when I looked like that, when I felt like that. And then the new person says, oh my gosh, I don't think I'm ever going to feel like that person that's graduating today. And but they do. Yeah.
Okay. Bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist Paul White. This morning we're talking with Renee Meyer and Molly Frantz from Mental Health Intensive Outpatient Program of Aultman Hospital.
All right. Can we talk about what type of patient symptoms or maybe diagnosis that patients could have that would benefit with your program?
Take that. Okay. Yes. So now the main thing that we do in the program is we focus on symptoms, not so much the diagnosis, but different diagnoses that we've had in the program are depression, anxiety. Those are two very big ones that or prevalent ones that people struggle with before they're coming in and when they're coming in. Bipolar disorder, schizophrenia, and I think with schizophrenia, one of the things that can happen is people think, or providers or family members think that they're not able to be helped, but depending on the severity of their disorganized thoughts, they can definitely benefit from skills use. And we have a skill called checking the facts, and that can be good for reality testing. for a person. So yeah, bipolar disorder, we also have, it's very prevalent for folks to come in with symptoms of or diagnoses of personality disorders. And personality disorders are just when somebody has developed ineffective coping skills, ineffective ways of communicating, and ineffective ways of interacting with people, and a very difficult time regulating their emotions when they're interacting. So those are the different kind of modalities, services, etc.
The symptoms, though, that we do see often that, create almost this web of connection amongst the diagnoses, which is why we focus more on the symptoms typically when we're talking about the skills.
Good word.
Thank you. Because typical symptoms we see low energy, low mood, as well as low motivation. That's a big one for a lot of people. And we see a lot of folks report poor sleep, poor appetite, concentration and focus, as well as racing thoughts. Another word that might be thrown out there is rumination. And really, it's kind of that enhanced level of racing thoughts to the point where it can almost be we're obsessing and dwelling. And crying spells is a big one, or the opposite spectrum, which is feeling numb, feeling like I don't feel anything right now. I want to cry, but I can't. And isolating, we mentioned that earlier as well in the conversation. Isolation is a very prominent symptom for almost everybody coming to the program. That idea that I just want to shut down, I want to avoid everybody, even people that I live with. I want to stay in my room more. I want to not eat dinner at the dinner table. I'd rather eat it in my bedroom. I'd rather eat it in the basement. I just don't want to be around people. So those kind of symptoms are pretty prevalent and common amongst all the diagnoses that we see in the program. So that's where our skills and the education that we develop and we help folks in the program start to gain better knowledge of really move them forward and managing those symptoms a lot easier.
I wanted to put in there also that, and this is sometimes people have difficulty talking about feeling suicidal, having suicidal thoughts. And it doesn't mean, in fact, that they want to complete suicide or attempt. There's a continuum, meaning, so maybe on this more severe side of the spectrum, I've got intent and I know how I'll do it, but while they're in the IOP program, but I can keep myself safe. And then it goes down the continuum a little bit. Like I've had thoughts about how I do it, but I don't have intent. And then it goes even a little bit further down, less severe, of suicide ideation, where I don't have any intent. I've not been making plans or anything like that, but I'm having thoughts like, if I didn't wake up tomorrow, I'd be okay with that. Or I'm such a burden to my family that I don't know if I can do this anymore. And we call those sort of vague and fleeting suicide ideation. And a lot of times people are afraid of, if I tell people this, they're going to put me away, or that they're going to think I'm crazy. And that's not it at all. It's just, again, people struggle with some very distressing things out there, and some situational, but some that it's just an increasing level of symptoms. So.
Okay. I'm a pharmacist, not a therapist, and I've talked to a lot of people over the years about their problems, and they stick with me. Okay. How do you, I don't know how you folks handle this stuff in listening to other people's problems, and then they don't get to you.
We eat ice cream.
All right.
Ice
Okay.
cream. We order candy machines as emotional support machines in the office.
Putting a plug out there, Debbie, for us.
Yes, wink, wink.
But being serious about it,
Yeah.
one of the things that, when you are going to school for this, you have, you do not go into this to fix yourself. That's just not, you have to be okay for the most part before you come into this. And you have to be really, really cognizant of your self-care, being trustful of your partner, to be able to talk about things honestly, because it is difficult and you don't want to take it home. So the things that you're trying to impart onto your patients for self-care and healthy living and things like that. It's true about the ice cream, by the way, but you can't solely, you have to be a well-balanced person, and you have to be able to think your way through, and to be able to leave it at work. And that's just a continued kind of practice, but you have supervisors, clinical supervisors that help you through that, and then counselors that have been here for a long time. And so it's just something to practice.
Yeah, and that's one of the benefits of having, as I mentioned before, more of like a treatment team approach, and that's what we have here through our IOP. Is we have a group of people that we can discuss clinically the things that are concerning, but also if things are starting to become more personal, if we start to notice, I think I'm having a hard time with this one because ... And whether it's, something that you bring up to, your team member or a different provider, there's many of times when we were going through schooling that it was recommended we have our own counseling. We sit on the other side of the table, so to say. So that way, that is how we are able to empathize and be compassionate and also understand the importance of being able to talk to somebody about these things when we don't want to take it home, but what do we do with it? And so being able to know that I've been on the other side of the table or have experience through training to be able to kind of compartmentalize and separate the personal aspect of it versus the professional sometimes. Not easy to do, but.
We meet with Dr. Snavely too, who is the psychiatrist in the program. And, just like the people in the program, the patients, they get different perspectives from each other and from us. We get different perspectives from not just our co-counsel, but also the psychiatrist, because, he's got he works on a different level with them. Different scope. So he has a different perspective. And so it's pretty neat.
How about the average age of the group members?
So typically, average age, I'd say, that it varies, ironically, depending on the time of the year. We go through cycles where we have a lot of younger folk, and then 18 is the minimum, though. We don't take anybody younger than 18, but we take any age above that. And we've had 90, was it 96?
No,
92,
93.
92, 93-year-old in the program, just a spitfire and it ranges all the way from, and we've had, I think it was an 18-year-old at the group at the same time as the 92-year-old.
Which is cool because, with the different generations in here, you can take a look at this is a grandparent here, but over here we've got somebody that can be considered a grandson, or a mom in the age, and a daughter over here. They're not part of the same family, but those offer different perspectives of what people are going through. And so we've had one person, a dad say, gosh, I was so glad to have this person in group because it gave me the perspective from my son. And so they could look at things a little bit differently.
Okay, ladies, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
Okay.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White, pharmacist Brad White, and I thank you for joining us. So let's get back to the final segment of the show. How often does an individual meet with a counselor, one-on-one?
Typically, there are 3 sessions predetermined that typically we schedule while they're in IOP. So that first individual is considered the intake. That's that first one-on-one. And then right around day 6 in the program is when we meet again for their next one-on-one session. And then typically we'll check in with them right before they get ready to graduate the program for another sit down, go over, any changes, any concerns, but also just to give them an opportunity to meet with us before we go over their, post follow-up appointments, which is, done at the discharge session, which is another one-on-one. But what we always tell the patients when they come in, especially if they have, a higher level of stressors coming into the program, a lot going on, we always say, if you need to meet more than what we already have scheduled, please just ask and then we schedule it. So they can ask us at any time, hey, can we sit down one-on-one? I have something I'm really struggling working through on my own. Can we work on this real quick? And so between Renee, myself, and our other clinician in the program, the 3 of us, we tend to kind of coordinate, those individual sessions as needed.
And you can tell when somebody, when somebody needs a little bit more than group that day. You can tell. Not everybody's so forthright with, some people are shy with asking, hey, can I sit down with you? So it's really important for us to watch for changes.
Okay. Go ahead, Brad.
How about we've talked a lot about the patient. What about the patient's families? How do they interact with your program?
Okay. A lot of times when somebody first comes for that initial intake, and actually sometimes even before that, it's going to be the family member who calls into the program and asks for program information, and they're just getting sort of a feel for it because maybe that family member that they want to have come in here is in bed, really low functioning. And so we'll talk to them on the phone, and sometimes they'll come in with the patient for the initial assessment. Sometimes they'll call in if they have concerns, and of course we always take care of the HIPAA information and the releases and things like that. But family members, and sometimes the family member will come in separately from the patient because they've got some concerns or questions, or so they're welcome, and it's very helpful sometimes because not all the time does the patient have good insight regarding what's going on, and brains are sort of foggy sometimes when they first come in, so it's beneficial to be able to talk to a family member.
Okay. So earlier in the program, you mentioned that you've had patients in the group that some are just starting and some are getting ready to graduate. What does exiting the program look like, and what are the next steps for those patients?
Right. So typically when somebody's getting ready to graduate, we help coordinate their follow-up appointments. And so that consists of returning, if they already came in with a medication provider, they would return to that person for ongoing medication management. They also would be returning to their individual counselor if they came in with one. Those are the 2 primary individuals that we want to make sure people are set up with following IOP. And typically, if they do not have one coming into the program, we help coordinate that for them. And so we want to make sure they're supported after they leave IOP, especially with medication management and one-on-one counseling, because group counseling that we offer, which is called Aftercare, the Pathways program, that is that step down of IOP, which everybody who graduates the program is qualified and referred for that. That is that once a week group that we meet on Thursdays, typically 2:30 to 4. And that is just, an ongoing practice of skills. It's, a reinforcement of the skills, but also an opportunity to check in that same setting that they had an experience with IOP. It's comforting to know they're not having to go to a brand new group and have new facilitators, because Renee and I also facilitate that group. So they're going to see familiar faces. They're going to be in a safe space. And so as they graduate the program, they're not going to be, feeling like, oh man, I went through this intensive program and now I'm left back on my own. So we help transition them back into independent living, empowering them, but also making sure they have appointments set up and scheduled with, those ongoing providers.
Okay, so what does a person do to get started with the program?
Mhm. So I had mentioned earlier, sometimes it's a family member that calls in and would like to refer a person. Sometimes they'll be referred by their primary care physician or their counselor. So really, nobody needs a referral when they come in here. They just need to call us here in the IOP program. I can, the phone number is 330-451-2070. We'll go forward that at the end maybe, but and so they just need to give us a call. And most people start out their conversation like, yeah, I'd like to get some information regarding the program, whether it's the family member or a provider or the patient themselves. And so then we'll go on and give them the information, the days, the time, how the groups are set up, how the day is, all of the things that we sort of mentioned earlier in the program. So they just need to call in and start out like, hey, can I get some information? We sort of guide them from there. Mm-hmm.
Pretty tight on time, Brad. How much time we got?
We got about 4.
Do you? Okay. If a referral needed to re-enter, and how quickly can a person get started in the intensive outpatient program? If I call you right now, can I do it?
Yeah, so typically if you call us and you are interested in an intake, we look at our next available appointments to bring you in for that first session. And what we like to see happen typically is we schedule your intake, if possible, for the very next day or within the next 24 to 48 hours. And you come in for that intake, and typically the very next day we have you start in the program. Mm-hmm. And so that we get the ball rolling as quickly as possible. But prior to you coming in for the intake, we do a courtesy benefits check. And so one of the stressors too some people have coming into the program is financial, and understandably so. When we're not feeling our greatest, finances may or may not be at the top of our list of concerns. But a lot of times people coming into a program such as this aren't really sure how to go about the financial aspect of it. And so we check with their insurance, we call them personally, we get all the information for them, and make sure that we're in network. And we also complete that and go over that information with them before their intake.
Insurance is very stressful for people.
Yeah. And so we try to lessen that load of stress for them.
Ain't it the truth?
Yeah.
And they're changing all the time.
Yes.
Yeah.
Adding new ones, changing all the time. And so we want to do that due diligence for that patient.
Mm-hmm.
Okay. Very interesting.
All right. Any final thoughts that you'd like to leave with the listeners today about your program?
So what I would like to say here, in summary, if you are not sure and you still feel like I need help, I need more than what I'm doing, even though I've been doing helpful things, but I feel like I could do more, or I could feel better. I'd like to feel better.
Even just a consult for options.
Yeah, because just call in, because we have, even if people sometimes either can't do our program, or whether it's after the insurance, you name it, some people that we talk to are able to participate, but it's not a waste of our time. We're happy to help guide you in a direction of support and get you the help that you need, even if it's not with us. Mm-hmm. And
okay,
so ask that you call in, and we can kind of help figure out maybe what you need in that moment. And if it's us, we're right there for you. And even if it's not, we're there for you.
Okie doke. We're out of time, I think. Thank you to our guests, Renee Meyer, LPCC, and Molly Frantz, LPC, from Aultman Hospital Mental Health Intensive Outpatient Program.
Thank you.
If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we will see you right here again next Friday. No, we won't next Friday. But we got another event next Friday, okay? And right here on Medicine Center Pharmacy. Have a healthy week, and we see you again here on News Talk 1480 WHBC. Thank you very much, ladies.